apex, base, neck, and trigon. This is an anteverted uterus, transabdominal, anterior, posterior, superior, inferior. So what plane am I in? What plane am I in for this uterus? I'm in sagittal plane because I see all of the uterus. Okay? Same thing. This is transvaginal, anterior, posterior, superior, inferior. This is a ureteral jet. This is important for us when we're doing kidney work. If we can't find a kidney, go down and look and watch the bladder with color on it. If you see a ureteral jet, then on both sides, then you know that you have missed the kidney. Go back and look again.
So is it indication of there's kidney in the body but you can't find it?
Correct. If I see two jets, I have two kidneys. Okay? So here's my uterus with a very full bladder. And here is a uterus with a little bit of fluid in my bladder. And this is called a curved measurement. You'll see that those being done. We have it on our 2 ATL machines, and you'll see it done in clinic. So transvaginal, okay? So this would be inferior, this would be superior, this would be anterior, this would be posterior. So here I'm looking at the right ovary. How do I know that's my right ovary?
On the right uterus.
Oh, the follicles.
Yeah, I know it's right ovary because it's to the right of a transverse uterus. Now, sometimes in a sagittal uterus, you can see an ovary at the fundus. They can be anywhere, okay? It depends on the ligaments. So, we all have them, but where are they? You know, so this is a transverse uterus, so this is my right ovary.
So can they fix it? Like put the ovary back to where it's
Why would they? Why would you want to have surgery when it's not a problem? It's just normal anatomy for you.
You will?
Now, when, not for you. Okay, because when a woman has a hysterectomy, you don't know where the doctor tied those ovaries up to. They secure them because they're only, the suspensory ligament, they're going to be too mobile. So what they do is they take the ovarian ligament and then they tie that to the uterine sidewall also. So the ovary is on the uterine, on the pelvic sidewall. But where? Does he take it up this way or does he take it down that way? Does he take it to the back? Does he take it to the front? I guess it's just whatever he learned in medical school. So it's our job as a sonographer to find those ovaries. Okay? Again, this is a transverse view because it's my transverse uterus, and here is my right ovary. What's over here on this side? Nothing but muscle and vessels. That's the only thing. Okay, so the cervix is the first part of the uterus, and then the lower uterine segment is between the cervix and the endometrium. And then you have the corpus is the body, and then the fundus. You shouldn't see any endometrium in that area whenever you're taking your images. This area right here is called the cornua. This area right here is called the interstitial. This is my uterine cavity. Here is my endometrium. It has zona functionalis, zona basalis, the myometrium, and the
Perimetrium.
perimetrium and or the serosa.
Can go back to the yeah. So now if we do the endovaginal, we enter the probe here.
You insert here.
Yeah.
So, and when you do transverse,
Yes.
transverse cervix, transverse lower uterine segment, transverse at the widest part of my body or my corpus, and a transverse fundus, no endometrium. If I'm in sagittal, midline, with and without measurements, with and without measurements on the endometrium. Then right uterus, and then right uterus. Go back to midline,
Left uterus.
left uterus, left uterus. Yes.
I have a question. When you're doing transvag, are you pushing the transducer like all the way to hit the
Okay,
cervix?
that's a very, very, very good question. Okay,
Mm-hmm.
here's my transducer. I've put the transducer inside. How I hold it is I put my little finger at that little notch. At that notch. Okay? When I push it in, I feel whenever I hit the end of the vagina, I hit the cervix. I feel that with my little finger. Who fishes in here? Who fishes? Nobody fishes?